are three modifiable workplace factors that PSP organizations should focus on to improve PSP mental health?
Well, it's actually an interesting question. And that I think before talking about what we know from research on three possible workplace factors that PSP folks should consider, um, I think that the first thing is to take a step back and say that at a at an individual organization perspective, that what probably is necessary first is to actually do a risk analysis and a comprehensive needs analysis to better understand what what some of the issues may be at a given workplace. So, for instance, what can we learn from claims data? What do we know about job turnover or work absence? And what might we know about them from the perspective of at a departmental level or at a large organizational level? So to be able to better understand, are there some issues that deal with work absence, costs, or work productivity that may need to be looked at further? So do we have some indications? The other thing is that with this data, because things change quite often in organizations, and many organizations may have um, flavor of the month interventions, for instance, that it's probably a good idea from the perspective of gathering data is to have a 3-year perspective so that one can see, are there some specific trends? And also whether or not, if there are some benchmarking within the industry, where are you in that benchmark comparison? So those types of things are important aside from some of the workplace factors that we can say are likely to be of interest, in that we know that they are predictive or have predictive value around work absence or disability related costs and work productivity. So that maybe the first one that I think is probably the most relevant, particularly when we look at some of the research that was presented at the CAHS conference, is looking at job demands. Now, job demands include like work elements that affect the pace of work, task complexity, and also physical, cognitive, and emotional demands. And that when we looked at some of the major pressures, we knew that within PSP, there's been problems with recruitment before COVID, but we know that there were excessive job demands, lots of overtime occurring within a number of PSPs, as well as when PSP workers had COVID and other workers had to take their place through overtime. That was particularly problematic. And then the second one I would think is job control. We know from research that both job demands and job control are probably two of the most studied modifiable workplace factors. And they both contribute when you look at predictive value. They both contribute or are associated with issues related to work absence and costs and work productivity. So they're valuable to look at from an organizational perspective on whether or not these two factors have relevance to their organization. And now I'm going to talk a little bit about job controls, because just so that we are thinking about the same elements of job control. So job control is where employees have some skill discretion, or decision authority, or skill utilization. It can also be where a unit might have work team authority, decision authority. So it's giving some control of what skills to use and how to use them. And also job control is also time, work time elements as well. So now, before I go on to the third one, I'm going to bring in one of the sort of the study recommendations that was the result of our pattern analysis, 57 systematic reviews, which identified that participatory approaches, that's where you have labor, management, leadership engaged in some participatory activity around problem identification, problem clarification, and also then problem resolution. And that's another element, and it's an element that's also associated with the third modifiable workplace factor, which is social support. And so this is another area where there has been some research, particularly within the PSP literature, that saw that where people had rated that they had higher levels of social support, they had lower risk of PTSD and also of other major mental disorders. However, there's also some more recent research that came out after ours. It was a study that was done looking at social support interventions with correction officers in particular, and noted that social support alone had very little impact. And what the researchers hypothesized, which goes back to this idea of participatory approaches to problem identification, is the idea that if you don't address issues of job demands and some job control, that social support in itself may not be all that effective if you haven't addressed elements of where there's excessive job demands, for instance. And so they could be mediating factors around social support, which I think is pretty interesting, and is an area that I think future research could explore more, as well as we learn more about why interventions have successes and why they may also have failures.